Hello, today we're going to be talking about GI bleeds. So what is GI bleeding? It is a symptom of a disorder in the GI tract, and the GI tract starts at the mouth and ends at the anus, and it covers the esophagus. Some people refer to this as like the food tube. So when you eat, the food goes there and takes it to the stomach, and then you have the small intestines to the large intestines to the rectum and the anus where it's excreted in stool. Sometimes GI bleeding is obvious and sometimes it's not visible. It can range from mild to severe, and some signs and symptoms to look out for include blood and vomit, and this can be either bright red or dark brown and black and kind of resemble coffee. Black tarry stools. Sometimes there's rectal bleeding, or you can have dizziness, lightheadedness. And how is this diagnosed? Well, through a variety of ways. Blood tests, which look at your blood count to make sure you have enough, or if you're losing too much, as well as hemoglobin, which is important because it carries and holds on to the oxygen in your blood, so you want to make sure that you're getting enough oxygen. But if you're bleeding too much and you don't have enough hemoglobin, you can have low oxygen as well. Stool tests, because sometimes the blood isn't obvious in the stool. And so a stool test can help determine if there's even faint amounts of blood in stool. There's something called an upper endoscopy, which is a little scope with a camera, and it goes through the upper digestive tract, so the mouth, the esophagus, the stomach, and parts of the small intestines, and looking at the digestive tract. As well as colonoscopy, same thing, only from the other end. So it's still the scope with the camera. It goes through the rectum and the anus, looking at the rectum and the colon, so the large intestine. There are also other imaging studies, so CT scans can help identify sources of the bleed as well. So what causes GI bleeding? There's various causes. Peptic ulcers are one. These are usually due to an infection called H. pylori or Helicobacter pylori. And they cause sores to develop on the lining of the stomach and the upper portion of the small intestine, which can cause bleeding if they become irritated. Esophageal tears, so the esophagus, there can be small tears in the lining. There's esophageal varices, which is just enlarged veins in the esophagus that can bleed. This is usually due to some kind of liver disease or liver failure. There's also diverticular disease. So these are small pouches in the digestive tract, mostly in the colon, so in the large intestine, that can become inflamed and then they can bleed when they become inflamed. There's inflammatory bowel disease. This is usually ulcerative colitis or Crohn's disease. These just cause inflammation. It can cause bleeding, and so you would see the bleeding in stool or in vomit. There's hemorrhoids, which are swollen veins in the anus and lower rectum that can sometimes bleed when passing the stool. Anal fissures are just small tears in the lining of the anus. And some other risk factors include smoking or alcohol use, taking medications such as what are known as NSAIDs or non-steroidal anti-inflammatory drugs. Such as examples of these would be aspirin or ibuprofen, so like Advil, Motrin. These can cause irritation to the stomach and the stomach lining and can cause bleeding over time, or you can have bleeding from anticoagulants or blood thinners. So some treatment options and diet modifications. So treatment options for GI bleeding, most oftentimes it's self-limiting, meaning that it resolves on its own. If that's not the case, treatment is directed then towards the cause. So for example, upper GI bleeding, the most common is peptic ulcer disease, and a way to help treat that would be drugs called PPIs or proton pump inhibitors, and these help to decrease the amount of acid production in the stomach so there's not as much irritation, so then there wouldn't be the bleeding. Another example could be a colonoscopy or an endoscopy done, because you can have polyps in the lining of the digestive tract. When these become irritated or inflamed, they can bleed. And so as a way to counteract that bleeding, you can take the scope and remove those polyps. There are medications, so the example of the medications would be those proton pump inhibitors to decrease acid production. And then after that, focusing on treatment, fluid replacement. Depending on how much blood or fluid was lost, you might need IV fluids to help bring up the volume again, or you can have blood transfusions if you lose too much blood and we need to replenish that. Some diet modifications include limiting or reducing alcohol intake, since this is an irritant to the digestive tract. Increasing fiber in the diet. This helps to keep the stool soft and helps prevent constipation, which can cause straining, so then you can get things like hemorrhoids or those anal fissures. And so this can help to keep stool soft so it's easier to pass. In some ways, you can increase fiber in your diet in fruits and vegetables or whole grains. Iron-rich foods during bleeding or right after active bleeding, especially in heavy bleeding, because you want to replete those iron stores that you might lose with the bleeding. And so some examples of this include fish, lean meats, poultry. The iron uptake is even more if you combine it with vitamin C rich foods. And then some other diet modifications include avoiding irritants or things that might make you bleed or make it worse. So some examples of this are chocolate, soda, teas, energy drinks, caffeine, so coffee, or spicy foods can help irritate it as well. Those are some references, and that's it.